South Africa, where its ongoing power outages have become far more than an inconvenience in the country, making millions of people anxious and stressed out and mounting a toll on the public's mental health. Citizens say power cuts are damaging small businesses, increasing cases of theft, such as cable theft, affecting productivity levels for people working from home and with no backup power supply, among several other impacts.
On the other hand, the rising cost of living has posed a significant risk to the population's health, and in particular its mental health. According to South African Anxiety and Depression Group SADAG, there has been an increase in callers experiencing symptoms of anxiety and depression due to financial woes and the ongoing power outages. Joining us now to give us more insight on this is the South African Anxiety and Depression Group Operations Director, Cassey Chamber. Good morning, Cassey. Thank you very much for joining us. It's very unfortunate to see what's been happening. We've been talking about festivals, conversations about load shedding and the power outages. Basically, I can imagine how much of a terrible impact it would have on the mental health of South Africans. You are the first person, you and your organization have direct relationship with that. So first of all, give us a picture of how this is impacting their mental health.
Good morning, and thanks so much for having me. It's such an important issue. You know, we've directly seen so many people in South Africa who've reached out from different ages, different backgrounds across the country who've been impacted, their businesses, their families, moms with new babies who are now having to navigate the stresses and anxieties of not having power to look after their children, education, work. So many aspects of our lives have been impacted, and so many people are reaching out feeling really anxious, really stressed. Some have even had trauma triggers. Being alone in the dark for long periods of time can be very scary. It could trigger some of their past experiences. So for a lot of people that are reaching out, it's definitely a contributing factor to their overall anxiety and depression.
What level of support, would you expect, to be given to, persons like this? Because, it's not likely that this would end, tomorrow morning or next week. It might be for a bit before ESCOM and the ANC puts its act together. What level of support, are you expecting to be given to people who are struggling mentally with this new reality in South Africa?
That's such a good question. And when we see some of the news that we've received that we can expect load shedding for the next 2 years, I think a lot of people are feeling really anxious and nervous. How are they going to navigate this? Having to sustain their families, their work lives, all of so many different aspects, it costs money. And for a lot of people, we can't afford that. So I think for a lot of South Africans, we're feeling quite overwhelmed that in the next 2 years, this is our new reality, at least for the next 2 years. I think when we're looking at support, we already had pre-COVID, pre-load shedding, we already had a mental health crisis in South Africa where we didn't have enough resources. We don't have enough hospitals, hospital beds, mental health professionals. So we were already starting with an urgent need to provide more mental health services to the population, especially when we're looking at the fact that 1 in 3 South Africans will or do have a mental health issue. Now we're adding more contributing factors such as load shedding, which increases anxiety, depression, the need for mental health treatment. At the moment, there's no specific strategy or task team looking at the mental health needs. What we know as SADAG is we're definitely looking to understand how better we can support South Africans who are navigating through these different challenges. We provide free telephone counseling to people throughout the country. We also have over 160 support groups. So we're looking to connect people to other people who've been through similar situations. I think in South Africa, with the direct impact of the economic crisis as well, for a lot of people, accessing mental health services is really expensive and often seen as a luxury. So the minute when we have cost of living, as you mentioned earlier, the high strain on the economy, people then start to not access mental health treatment. So we're encouraging people on how to access, where to go, how to get the support that they need. So this will be part of our strategy as SADAG going forward, at least for the next 2 years, is making sure that we can provide free support services to all areas within South Africa.
I think that's incredible work that you at the SADAG team are doing. So thank you, first of all, for being there to offer free counseling and basically being on the phone available to people who need to talk. You gave statistics of 1 in 3 South Africans That was pre the current situation of things. Now there's a lot that's come on. There's load shedding, there's a high cost of living. There's still violence, domestic violence, violence against women, and there's gun violence. Today we talked about the story of a number of people who unfortunately were killed at a birthday party, who were shot at. Now, whilst SADC is doing the best that it can to offer mental health support to people who are currently dealing with anxiety and depression, and including the new numbers that have been added to the existing statistics, the unfortunate truth is you will not be able to get to the whole of South Africa. So for those who cannot access the help that SADC is offering and cannot be able to afford mental health care because of how expensive it is, what tips would you give to them to be able to manage their anxiety and their depression, pending when they're able to get professional help?
I think the first start for every person, we all have mental health. It doesn't mean that we all have a mental illness. So every person should be doing something every day to look after their mental health. And it could be looking at ways to de-stress or relax, especially with all these contributing factors, which add so much additional stress to our day-to-day. So really looking at free self-care tips that you can do at home or wherever you are, such as breathing, connecting with loved ones, and really making sure that we're doing a lot more of things that we enjoy to help fill our cup, to make us feel a little bit less anxious and depressed and lonely. I think for those that do need to access mental health services, it's really going to their local clinics and seeing the nurse, the doctor, or the psychiatrist for treatment and support through those local community clinics. And we do have those clinics throughout South Africa, so there is that resource that people can access. I think what's also really important is that we could also, as individuals, look at how to provide support to people around us within our families, whether it be checking in, asking how people are really doing, and just listening. Sometimes just being there, offering support, and being kinder to others and ourselves can make a huge step in a world where we often feel quite overwhelmed and quite anxious by the problems that we experience.
Well, from the picture you've painted, it also might mean that a lot of Nigerians have similar mental health issues, because load shedding is, part of our reality, and it's been like this for decades. To be honest, Cassey, when South Africans talk about load shedding and how they're so distressed, and this is affecting businesses and all of that, a lot of Nigerians hear these things and they can't relate, because this is normal here. But of course, there's so much work, that would need to be done. Do you think that the South African government, as it stands, has that much concern about the mental health and how these things are affecting South Africans economically and mentally?
I think if we look historically as to how mental health has been supported or how budget has been allocated in investing in mental health, we just know that less than 5% of our health budget is allocated to mental health issues. So absolutely, we do need more budget allocated to mental health care, and not necessarily focusing the higher percentage of that budget into inpatient hospital care, but we're needing to really allocate resources, financial resources, and manpower to community mental health services on the ground. So no, we definitely need to do more. There isn't enough, and we can see this by the need and the strain on the current mental health care system. And we need to have a strategic plan in providing that care. And as you mentioned, which was, I think, really critical with regards to mental health in a global perspective, I think as many governments and countries, we often become complacent by the mental health impact of our day-to-day livings and struggles. And I think that there has to be a much bigger conversation, a stronger focus on investing in mental health care, because it affects everyone. It doesn't discriminate. And if we don't look after our mental health, especially undiagnosed or untreated mental illness, it has a direct impact on our country and companies' overall bottom line. So it's a good economic practice to invest in good mental health care services for the well-being of an entire country.
And whilst you've raised a very valid point looking at mental health on the global scale, I'm going to bring it to the continent of Africa and some of the things that governments around the continent can do. Now, some people, some older people, look down on conversations about mental health because for the longest time they've been used to abuse. So it's assumed that, oh, you should be able to handle this, you should be able to deal with this, your generation is fragile, but we're learning differently. So how would you say that governments around the around the continent can do better? You know, some of the arguments would be that there have been people who say that HMOs and health insurance schemes should also cover mental health, and maybe there should be ads or maybe reorientation, or I don't know. So what sort of suggestions and maybe policies you can give to people, organizations and governments around the continent on how they can prioritize mental health, because it is an important conversation to have.
Absolutely. And I think it's about having more of those richer conversations with key stakeholders around the same table. You know, often when we think about reviewing policy, we have academics and government, but we're now having to include a multifaceted stakeholder engagement where we're including people with lived experience. And you're so right around the generational idea of mental health and the stigma that's so attached to talking about it and admitting and sharing a mental health diagnosis. I think our young people are being a lot more verbal and sharing their own experiences. And I think those rich experiences, it's what should be directing policy on the ground. So I think having the right people around the table at those conversations, including government, mental health professionals, the private sector, and people with lived experience, and the community organizations on the ground trying to make an impact. I think coming together, we need that collective action. I think some ways that we could be looking at improving mental health on a global perspective is definitely looking at reviewing policies. There may be a lot of really good policies, which a lot of the developed countries have, but what we know is what's on paper doesn't always translate to what's happening on the ground. So really looking at an implementation plan that's realistic, that's backed up by a budget, and that we can actually make it work on the ground in communities. I think by starting this conversation, it's really encouraging more and more people to talk about it. So even companies to be looking at their own internal mental health policy, because mental health also affects employees and affects companies' bottom line. So bringing all these key stakeholders around the table is really important. And I think what we could do to advocate to governments is about allocating and really investing in mental health and putting a budget behind prioritizing mental health, which could see a huge impact for people on the ground.
Wow. You know, there's no better way to wrap up that conversation. Cassey Chamber, thank you so much for your time, and well done to you and the team at the South Africa Anxiety and Depression Group. We hope that more South Africans will be willing to reach out to access the free services that you're offering in this time to support them. And we hope that in the nearest future, we won't be having conversations about how it's not as prioritized and load shedding, high cost of living. We hope it will be a thing of the past very soon.
Thank you very much.
Thank you very much.
All right.